first started this program, we wanted a relatively controlled sample base, so we could grow at a reasonable rate. And we started with, really 1/2 providers at the medical practice. However, within a month and a half, 4 of the other providers have asked, when can I start referring, because their patients had heard about it too. These patients are seeing so many different providers, specialists, in Richmond and other places that they're going to see. So a lot of times, the primary care charts may not be updated, and we've been able to help the doctors update their chart.
And then also a lot of times, you find out that the patients, of course, they're self-medicating. They're not taking the medications the way they're prescribed. They're missing doses. For instance, I had a patient who is on gabapentin 3 times a day. She can't remember the dose in the afternoon, so she's only taking it, twice a day. So you find that, a lot of times they're missing doses as well.
2 patients brought these in the first month of our chronic care program, which we were shocked. What we're doing is patient care. It's the best patient care. We are taking the time to ensure the patients are on the medications that they're supposed to be on. We're taking the time to go over their VG levels for the prior month. We're taking the time to go over their A1C levels, and not just documenting this on a chart, but actually taking the time to make sure that they're progressing properly and improving. Christina and I, we were talking about the nutritional information that we have been able to give patients that didn't know what they should eat to help with their diabetes.
Dr. Anderson, he's been working with me, trying to help me, but it's just I didn't know what I could eat or what could I eat. I just didn't know anything about what I should eat or shouldn't eat, so I was just eating anything that tastes good. About 3 months ago, he asked me if I would be interested in participating in a program with a pharmacist, and I said sure. And since then, I seem to be losing some weight, which is good, and I am exercising.
I think one of the things that across the board with the patients that we do have in the program, one of the main things that we found is patients honestly, they don't know about disposal of needles. We took the time to explain to them, the importance of proper needle disposal. One of the other things is patients with their insulin pens. They were always keeping them in the refrigerator instead of just keeping that one pen at room temperature. So proper storage of their insulin as well.
A few concerns from the beginning, the resources and time. Was it going to make enough revenue for the time expense that goes out? It's been a great source of revenue to our pharmacy, not to mention the number of new customers that we have gained from this program.
I've had diabetes since 2002. The toughest part would be knowing how to keep your numbers at a low rate, because the best you do sometimes doesn't always seem good enough. So when you try to do what you can and you struggle with that every day, you try to eat the right thing and still your numbers may fluctuate. You try to drink the right thing and it still might fluctuate. I'm a walker. I exercise like walk 2 miles a day. And even in my best, sometimes still not good enough. I think it would be wonderful to have a program that could assist me in this very dire matter. Sometimes taking care of myself is very difficult. It's a struggle every day on a daily basis. I try to do the right things, though, to make that struggle easier.
We live in a small community, and the word has gotten out that Christina has, improved so many people's, lives and health, especially with diabetes.
It makes me feel like that, what I went to school for, that I'm able to help, impact the lives of these patients. And we actually, can make a difference, and help with the relationship between the patients and the providers as well.
We've got over 85% of the patients that we have started in the chronic care program still participating. So we are very proud of that. Starting January 1st, we are going to add 4 more providers and their patients.
I'm very thankful for Dr. Anderson sending me over here. And I'm very, very thankful for Christina and Carter for helping me like they're doing. And I hope they keep doing that. And I wish all pharmacists would do this because it would really help people.
I've been coming here since they've opened, and I trust them with my life. I feel like that they have my best interests at heart. I've worked with them for many years, and Carter's grandfather was my pharmacist in his day, and I've followed down the generations, and I just believe in them wholeheartedly, and I wouldn't have it no other way.